any fungals that you can use. If that doesn't work for at least a month, after a month, you should probably go ahead and see a physician and get a proper diagnosis. But a fungal infection is probably the most common, skin affliction in the feet.
Okay.
And ma'am, feel free to call the 800 number on the screen if you want a referral to a podiatrist near you. We actually got a writing question from somebody who didn't want to talk but left this question. They want to know, what types of things do people do in their youth or not do in their youth that can result in arthritis or circulatory problems, and perhaps what steps can we take in our 30s and 40s to prevent these problems from coming home to roost in their 50s, 60s, and 70s? It's a good question.
Let's start with the circulatory problems. Obviously, smoking is probably the biggest culprit of really ruining your circulation. Outside of that, cholesterol, watching your cholesterol, other healthy lifestyles that affect circulation is key there. As far as arthritic things, it's hard to really avoid arthritis. Most of us people are active. We walk on our feet. We have no choice. But wearing proper shoe gear is very important. If you have bony deformities or foot function that is improper, orthotics are a good option to make sure that you're walking correctly. It's amazing how many people I see every day that just don't wear the right shoe size. I would say 80 to 90% of the people wear the wrong shoe size. Oh. It's really amazing what people try to stick their feet into. And that obviously will lead to problems down the road.
And arthritis has such a family history component to it. It's really hard to really figure out what exactly is going on.
Especially when it comes to rheumatoid arthritis, there's a definite link to heredity.
Exactly. Okay, great. Thank you. Thanks for those calls. Now I want to talk a little bit about specific problems that may end up either as a result of some of the diseases that we talked about, or just other sorts of garden variety problems that you see in your practice all the time. And let's start with bunions first.
Okay.
You said about 80% of your practice is sort of 55 and older. How many of those patients would you say have bunions of some kind?
Oh, at least 50%, I think. Bunions are very, very common. If people don't know what the bunion is, it's a deformity of the first big toe joint right here, where the joint becomes out of alignment. The big toe starts to drift towards the second toe. The second toe can sometimes drift over the big toe, and that's probably the worst severe part of the deformity. That's what we call a stage 4 deformity of a bunion. All bunions, or most bunions that are that severe, obviously need a surgical correction. There's no pill you can take or shoe you can wear to correct a bunion. There are splints that some people can wear, perhaps that have a mild bunion that may cushion that joint. But to align the joint, surgery is necessary. It's like having a tire out of alignment. The cartilage will wear out eventually. The joint will become frozen, and pain, comes after that.
Okay. We're in a lot of car analogies today.
Yeah, a lot of car analogies today. People understand those.
That's right. That's right. What about ingrown toenails? That's also a big problem, isn't it?
Ingrown toenails is probably the most common thing I treat on a daily basis. If people don't know what an ingrown toenail is when the side of the nail gets caught into the skin nail groove, the toe becomes swollen, red, painful. There may be drainage if infection occurs. If you cut your nails properly, and most people use the wrong instrument, I find, to cut toenails. A proper toenail cutter is necessary. If you can't cut your toenails yourself, see a podiatrist to cut the toenail properly. And if the nail becomes severely infected, and a surgical procedure may be necessary to correct the nail on a more permanent basis.
Oh, that's serious. I want to get back to that later, but we have a call first.
Sure.
Go ahead, caller. Welcome to Feet Forward.
Yes, on my right foot, and the bottom foot, I keep getting a corn, and I'll cut it out, and it feels good, but then it regrows. What is that?
Now, you said on the bottom of your foot.
It's on the bottom, like on the middle of where my big toe is, but on the middle toe, more down about an inch off the toe. Okay,
so usually what that's called a callus. A callus occurs on the bottom of the foot, under the ball of the foot, the weight-bearing area. A corn is usually on top of the toes. A callus is caused by improper weight distribution under the metatarsal heads. The most simplest way to treat it, obviously, is use a pumice stone, emery board to smooth off the skin. But if the callus keeps coming back, you may have to get an insole under your shoe to cushion your foot in that area. Obviously, if that doesn't work, professional treatment is probably necessary. Having a podiatrist trim down that callus properly, making perhaps a custom orthotic to help you walk in less pain. And if necessary, if that doesn't work, surgery is obviously another option that could be done to treat a callus and get rid of that problem.
Okay. Now, what do you recommend again?
Say that again?
What did you recommend again?
An insole into your shoe,
Okay.
like a gel insole or something like that to cushion the bottom of your foot is certainly a start. Proper shoe gear. Most people don't have a nice, comfortable shoe. It should have a nice soft inner sole, a firm outer sole, and should probably be laced versus a loafer.
Okay. Thank you very much.
Sure.
Thanks for your call.
Bye.
Getting back to the toenail question.
Okay.
You said a lot of people don't use the right tools.
Yes.
Do you have a recommendation on a certain kind, without mentioning a brand per se, but
Right.
what to look for in a characteristic of a proper tool?
A toenail clipper should look like a pair of pliers or wire cutters almost, and have a slight curved jaw to it so you can get into the corner. You know, most people say you should cut your nails straight across, and I don't think that's probably true for most people whose nails are flat. But if your nails are curved into the sides, you need a nail clipper that can get the corner out of those.
And these are available at most drugstores for.
I've seen them at all drugstores. They have them, and they're in the beauty care
inexpensive?
section. Oh, they're relatively inexpensive.
Okay. We have another caller. Hi, welcome to Feed Forward. What's your question?
Yes, sir. I was.
Oops. You still there? We lost her. Do we have another one? Okay. Sorry about that.
Okay.
So those are readily available, fairly inexpensive, and
Right.
are available at drugstores. What about fungal problems? Those are also very common in the elderly, aren't they?
Right. Very, very common problem. What you see on the nail is there's thickening. There's maybe a line through the nail. There's debris up underneath the nail that lifts the nail, and that can become painful. A very, very common problem. Usually the most common causes are injury to the nail, inheritance, believe it or not. People that have been growing toenails seem like the whole family has that problem. And even a low resistance to the fungus. Some people seem just susceptible to it for whatever reason. You know, fungus is a microscopic particle. It's everywhere in our environment. It's in the carpets, it's in the soil, and it's picked up all the time. Fungal nails, luckily, can be treated. There are topical medications. There's oral medications that are very successful. And if those don't work, the nail can be removed surgically.
Okay. We have another caller. Go ahead. You're on Feed Forward.
Hi. My question is, I had orthopedic surgery on my toes to have them straightened out. And the doctor, now they're turning again. It's almost as if the middle two toes are separating, and it kind of looks like they're in kind of a circular, that at some point they could meet and form a circle. That's how they're separated. Now, the bone on 3 of my toes, the doctor said that he, straightened them out. So he told me that he just did it from like the knuckle part of the toe up, and that if I had to repeat the surgery, he'd have to go further up into my foot to straighten it out. Now, my question is it my arches that are falling, and that's what's causing my toes to separate like that?
Well, I don't have that much information, so it's kind of, you're saying that, is it your large toe that's doing it, or your smaller
toes?
toes?
The center two toes, like my second and my third toe
Okay.
are forming, it looks like almost a circle.
And how long ago was your surgery?
My surgery was maybe like 2 years ago, 3 years ago.
Hammer toes can recur. In some instances, the toe can be fused. The bones in the toe can be fused to keep the toes straight. I don't do that too often in people because they like to be able to bend their toes. But toes can be straightened and permanently fixed so that they're straight. And that's what may happen